now a year and a half later, I'm really doing that, where every patient I see, the question is, am I absolutely the best fit? Can I help you more than anybody else can in town?
Yeah.
And if the answer is no, then it's, well, I know a chiropractor can really help you
That's right.
out.
How do we make a good team for the best outcomes for the patient, right?
Absolutely. So I wanted to talk about migraines today. I feel it's one of those problems that conventional medicine doesn't have that many answers. So there's a few fields. Obviously, in anesthesia, I feel we have all sorts of answers. I know how to put a patient to sleep, how to wake them up safely. But there's other issues, neurology, dermatology, a lot of endocrinology, where there's Crohn's disease or various problems where you have to resort to biologics and kind of ruining the body's own immune system to get the patient healthier. And again, this isn't the fault of conventional medicine. It's just that there are still a lot of syndromes where we're nowhere where we need to be as far as treating them.
Absolutely.
And I think migraines are kind of at the top of the list.
Yeah, absolutely, absolutely. As a migraine sufferer myself, I was excited when you wanted to talk about this. It's something that I've dealt with for years and worked with patients on. And one of the things when we were discussing this ahead of time that I thought was really a valuable thought is that in some ways for migraine sufferers, the treatment is diagnostic in and of itself, right?
Mm-hmm.
Because there's so many different forms of migraines, so many different triggers or causes that can be a part of this cluster that causes these type of symptoms. So
Yeah, absolutely. In fact, one of our mutual patients was telling me the other day, yeah, I was over there at Dr. Bob's and he was having an ocular migraine. I could tell.
yeah, yeah,
So it can be tough. And that diagnostic piece is interesting. This might be a little nerdy, but obviously at Alleviant we have a medical director.
yeah,
And the medical model is one of diagnostic. You find out what the problem is, what label are we going to put on it. And me as a nurse anesthetist, and really even pharmacist, it's more of like, what's the treatment? What's the care that we can provide that relieves the symptoms and gets down to the root cause? But I completely agree that if we're doing anything diagnostic, it should be treatment related too, meaning this is helping you, meaning that this is probably the source of your migraine. Or of course, this is not helping you, so therefore here's who you need to go to, or here's what the next step is.
right, yeah. Always having the ability to pivot based on how it's affecting the patient that you're working with.
Right.
For sure, for sure.
And I think for what you do as a chiropractor, it is more of like the first line where you have a headache, go to the chiropractor.
Yeah, yeah,
For me, being a nurse anesthetist, I've had patients say, hey, I have some headaches, should I come to you, can you help me? And I usually say, I'm not really a good first choice. Obviously, a lot of what I do is IV medications, more powerful interventions. The ketamine infusions that we do, for example, work really well for migraines, but again, this isn't for well, I had a headache last month and I might get one this month.
Right.
While in your case, it's more of, okay, I have an issue, let's get to the bottom of it right away and start with some chiropractic care.
Yeah, yeah. So I would say that our approach, being kind of like a first line for these type of symptoms, is usually the structural component. Tension in the muscles of the upper neck, which a lot of research has shown that people who suffer from specifically migraines and tension headaches have reduced mobility in that area. And then also looking at, are there some vitamin or other deficiencies or sensitivities and things like that, and then taking that approach. Beyond that, we're usually kind of working collaboratively with other providers like yourself, nutritionists, medical doctors, neurologists, things like that. So.